Howdy y'all, this is Rational Outlaw here. Today I have another video by Mike, and it's about healthcare. And more specifically, LGBT healthcare. And the speaker is a gay idiot. Now, let's get on with the video.
Hastily proposed budget cuts and healthcare changes under a Republican-controlled Congress have queer people worried about their health. And I know conservatives are obsessed with what I do in my private time, but in this one instance, maybe shoving something down my throat isn't the best way to seal the deal.
I wouldn't wish that on my worst enemy, to have to shove something down your disgusting throat.
Here are 4 ways the Trump administration plans to stop counting, researching, and treating the most vulnerable queer people in the US. After years of lobbying, we finally saw elderly queer people included in national healthcare surveys in 2014. But Trump's Secretary of Health and Human Services, Tom Price, chose to remove questions about sexual orientation from 2 of his department's surveys aimed at seniors. Because if you really care about a community, kneecap their oldest members first.
That only removes the question to ask whether they're gay or not. That doesn't really affect them.
But seriously, who cares if they're statistically more likely to live alone because a virus ravaged their partners and the government wouldn't let them get married?
That was gay men and bisexual men's fault, not the government. They didn't force them to have sex, and we have legal marriage now. What does bringing it up do, saying that we didn't have it back then? What's that going to change?
Trump also wants to cut funding for research that helps all of us. We have reliable data on drugs to prevent and treat HIV because of the National Institutes of Health, specifically through their Office of AIDS Research. But during an early round of spending proposals, Trump proposed cutting the NIH budget by 20%, which could impede the approval process for some of the drugs that matter most to the LGBTQ community.
The federal government only accounts for 31% of all funded medical research. And according to this article I found, the NIH is only behind 7 of the top 21 drugs that were produced between 1965 and 1992. Now, that's not to say that the NIH or that the federal government hasn't helped within the medical industry. It certainly has, quite a lot. However, I believe the free market will take over those areas. Even if we lose the funding for the NIH, the free market will more than likely take up that space.
To be fair, Trump has promised to maintain some Bush-era AIDS relief programs, but at the end of the day, Trump and Price are cutting money that was originally allocated for HIV research, prevention, and treatment. Speaking of treatment, let's talk about PrEP. When taken daily as pre-exposure prophylaxis, or PrEP, Truvada is up to 99% effective at preventing the transmission of HIV. The National Institutes of Health sponsored one of the largest PrEP studies in the country, meaning that without their help, we might not have FDA approval for PrEP use today.
Maybe so, but that was then, and this is now. And PrEP only can prevent HIV. It doesn't prevent syphilis, gonorrhea, chlamydia, or any other sexually transmitted diseases.
This is important, particularly because a CDC study shows that increased use of PrEP could prevent up to 185,000 new cases of HIV by 2020.
Is that all? Well, I know something that can stop HIV and any other sexually transmitted disease entirely. Just close your legs and don't be a slut.
But even if we preserve funding for research, it doesn't matter if the people who need treatment most don't have access to it. HIV disproportionately affects Black and/or Latino communities, who, according to a Department of Health and Human Services survey, are less likely to have access to consistent and affordable healthcare than their white non-Latino counterparts.
Wow, that graph just shows how stupid you are. That's on the Affordable Care Act. If the Affordable Care Act was supposed to give greater access to healthcare to everyone, why is it that Blacks and Hispanics are doing so poorly under it? And how does that relate to what Trump wants to do? Where are the correlations? Isn't that just interesting?
Fighting for our health means fighting proposed cuts in Medicaid that could further limit those most vulnerable to infection from protecting themselves against HIV.
This is the problem I have with the gay community. It is not a healthcare problem, it is a slut problem. Gay men and bisexual men are having multiple partners, which is a problem, and they're not using protection, which is a problem. Both of those things are the problem, not health care. So they should stop being sluts and put on a condom and have one partner. Stop treating them like victims. It's their fault they have a sexually transmitted disease. Even with healthcare access, the gay community has been on the rise with sexually transmitted diseases, while the heterosexual community has been dropping.
Planned Parenthood. It's not just for pregnant women. Every Republican's favorite punching bag actually provides STI and HIV testing, as well as gender-affirming hormone therapy. In fact, the organization averages 650,000 tested for HIV every year. A fact Mike Pence must know after a 2016 study showed that closing a Planned Parenthood in Scott County, Indiana, helped spur an HIV outbreak.
Oh yeah, it was certainly his fault. It's not like that gay and bisexual men are having multiple partners and having unsafe sex, right? Who needs a condom anyways? It only prevents sexually transmitted diseases. And who needs a monogamous relationship? I mean, that is so archaic. Oh, those straight people. Just messing with us.
While Republicans claim we spend too much on clinics around the country, the closure of just one Planned Parenthood shows how lives and costs could have been saved if conservatives stopped playing politics with our health. Data shows queer youth are at a disproportionate risk for bullying in schools, and statistically more likely to commit suicide. In 2015 alone, 75% of trans youth reported feeling unsafe in schools. So while old white men in North Carolina and Texas call trans people sexual predators with no evidence, and despite their own party's track record, they're also cutting funding to mental health services that queer people need when they're demonized just for being themselves.
Now, if that is true as to what you say, doesn't that affect everyone? Not just gay, bisexual, and transgender children?
By 2020, Republicans want to eliminate the requirement that Medicaid cover mental health services, and cuts to the NIH would likely affect the Mental Health Services Administration. The battle for fair and equitable queer healthcare isn't over. If you are poor, queer, a person of color, or all of the above, this administration's pursuing science and health policies that intend to leave you behind.
Citation, please. Seriously, where do you get this? If what you say is true, that affects everyone. Not just gay people, not just transgender people, not just blacks, not just Hispanics, not just Asians. It affects everyone. That includes whites. Everyone is affected by that. Personally, I don't want government health care. I want the government to stay out of my health care and stay out of the medical industry. Well, that's it for today. If you like this video, please like it and subscribe. Also, follow me on all my social media, and it will have all my sources down below. And I'll see y'all later.